Well, this still doesn't let me sign in. But, oh, well. I'm sure there's nothing life threatening on there.
Okay, today is Monday, April 10th. The time is 5:30 and I call this work session to order. Our lobbyist is unavailable this evening, and so we will go ahead with city updates from Ms. Solano.
Thank you, Madam President, City Council, and Mayor Gradisar. I have a couple of updates this evening for the city. And first is a really good recognition of the COVID numbers this past week are down to a positivity case count of 45.4 and the positivity rate down to 5.2 from 8.1 from 2 weeks ago. And the 9 days of stabilized hospitalization patients at Parkview. Also wanted to share that a reminder that the next citywide trash dumping date is scheduled for Saturday, May the 6th. And later this week, the full marketing pieces will be out with social media, the details for the city. They should have those out by the end of the week. And then I wanted to share kudos from Corinne Kaler, the president of the Pueblo Conservancy District, to Chief Huber and the fire department for their swift work to control the fire that was on the Aberdeen Bluffs this past weekend. So she asked that I share that kudos to Barb and the fire department. And then I have an ARPA update with quite a few items here. On the agenda tonight, there is a resolution for $250,000 in support of the Pueblo City County Library District for the parking lot renovation and the building of the bridge at the Barkman branch. Then they presented that about a month ago to City Council. On first reading is a $750,000 for Crossroads Turning Point. At the request of council is on first reading this evening. A first reading is also a $40,000 to support Pueblo Cooperative Care Center for the mobile shower program for the summer. On second reading is the $975,000 for Southern Colorado harm reduction for the community center investment. Upcoming for ARPA next Monday's work session. It's a pretty packed work session, but one of the items is an update from city departments on the $1 million trash program that includes an update on the same day labor trash cleanup to employ the unhoused. An update on the balance remaining from your action last year for the $300,000 to Public Works and to code enforcement, and an update on the schedule for the pop-up cleanups throughout the city that Public Works has been facilitating. Also coming up on ARPA is the next action steps for Crazy Faith Ministries request for the building of the purchase of that building for $550,000. Upcoming also on first reading on Monday, the 24th of April, the Lights On for Safety request is back on the agenda for first reading on the 24th. And we have a brief work session for updates this evening as well. And then also on the 24th is a request for lost revenue funds and your approval to purchase a skid steer. That's a piece of equipment to clean up the trash and other units so code enforcements can have their own without having to schedule or borrow from Public Works. And that does include the city updates this evening about ARPA and any questions or recommendations or directions for future presentations.
Thank you. Any questions for Ms. Solano? Councilor Martinez Ortega.
Yes, thank you. Thank you, Ms. Solano. I want to clarify if that city council members can bring forward ordinances, correct? Just anybody can. Well, I would like to bring forward a sub-recipient agreement ordinance for $200,000 to the RMSER on 330 Lake Avenue from the ARPA dollars. Bring together a resolution and ordinance. I'm not sure how that has to be put together. Running through legal to see if we can get that here for a vote.
Thank you, Councilor. They did submit a request, and so I'll ask our ARPA coordinator to pull that request back out and put it on the agenda for Wednesday's internal meeting, so we can send it back to the city attorney's office for compliance and review to ARPA.
Great, thank you.
Any other Maestri.
What is the status with Crazy Faith Ministries?
The
And their
Crazy Faith
request.
Ministries that just was discussed initially in the internal meeting last week. The city attorney did the review and the report's back this Wednesday. So we should have next steps. I talked to Lonnie today after Wednesday afternoon to say what was the city attorney's recommendations to get out to the mayor and to you. And I told him I'd call him after Wednesday's meeting.
Okay, thank you.
Anybody else? Okay, next up, we have our Narcan overview with Chief Huber, Sarah Money, and Dr. Mike Mendrell.
Good evening, Madam President, members of council. Thank you for asking us to speak on the Narcan. We're going to do a presentation this evening to explain Narcan and then also to explain some of the data in Pueblo, Colorado. This is Dr. Mandrell. He is our EMS director and he's also an emergency room doctor. So he will speak to how Narcan works. And then Sarah Money and myself will switch places and she will speak to the health department.
Okay, I'm Mike Mandrell. I'm an ER physician at Parkview Medical Center. Been here for about 6 years. Took over as the Pueblo County EMS medical director about a year ago. So just my understanding is there's Narcan has kind of come up as a topic, kind of some concern morally and ethically about its use. So I just want to come talk about it and make sure everyone's aware exactly how it works and kind of how we're using it in Pueblo. So to start with, if you see the slide up there, everybody's brain has opiate receptors and natural opiates that everybody, naturally produces in response to painful stimuli. It's an evolutionary feature that we all have, basically kind of associated with the fight or flight response. You're running from that tiger or whatever. You don't want to feel the pain initially until you can save yourself. The problem is we have too smart for our own good a little bit, and we've figured out ways to manufacture essentially hormones, opiates, that can mimic our own natural opiates. So that's morphine, fentanyl, Dilaudid, heroin. And so some of these are used medically to treat acute pain, and they have a purpose for treating, post-surgical patients that have fallen and broken an arm, but they're also abused by users here in Pueblo as well as everywhere else. So when you have an opiate overdose, you basically see a state of euphoria and overall depression in the body. So decreased drive to breathe, which is the main concern, as well as generalized weakness, just general depression of everything. But the individual that's experiencing it is experiencing euphoria. So what Narcan or naloxone, more appropriately does it essentially binds to that opiate receptor and can knock the opiate off. The difference is Narcan or naloxone will not activate the receptor. So the receptor basically is blocked and is no longer active as it would be if the opiate was bonded to that receptor. So why do we use naloxone? How does it save lives? Essentially, it can, within just a few minutes, reverse the effects of an opiate. So someone can be completely unresponsive, essentially dead appearing. They'll likely have a pulse, sometimes not, but they're not breathing at all, and they only have moments left to live. When we administer Narcan, which can be through a shot, IV, or intranasally through the nose, which is becoming the most popular and most common way to use Narcan, within just a couple of minutes, that person will go from being intoxicated on an opiate to withdrawing from the opiate. And just like any other intoxication syndrome, the withdrawal is almost exactly opposite of the intoxication state. So someone goes from intoxicated, feeling very euphoric, not breathing, very calm, to after Narcan feeling very confused, anxious, agitated, sometimes aggressive, but they're also in severe pain opiates obviously treat pain. So once you reverse it, you put someone in withdrawal state, it's extremely painful. You also see diarrhea, stomach pain, vomiting, and then some kind of flu-like symptoms, the feeling of fever, chills, tremor, runny nose, and sometimes a little bit of sneezing or coughing. So that it's not a pleasant experience in the slightest to receive Narcan or naloxone. I've never had a patient, at least in the immediate aftermath of receiving Narcan, be thankful for receiving the medication. They go from a euphoric state to a very much a feeling horrible state, lots of pain, vomiting, and just agitation. So it's not a pleasant experience in the slightest. So Narcan has to be available in the moment to be of any use. You know, you're taking someone that's not breathing, that only has moments left to live. If it's going to be of any value whatsoever, it has to be available. So we put AED, so you know, a device that can shock, you know, allow a layperson to shock someone out of cardiac arrest. We put those in public buildings, schools, essentially anywhere where there's large crowds, because that's where it needs to be, because it needs to be used immediately in a medical emergency to be of any value. Those same places are generally where Narcan can be helpful. You know, somewhere where there's a lot of people, you know, high public, essentially public areas. And they can be extremely valuable because they're available and easy to use. So they also want to point out that they are essentially harm reduction. They don't solve any problem except the immediate problem of someone that's not breathing. If you get Narcan, you still have to go to the hospital. There are lots of other issues with an overdose other than not breathing. I mean, you can aspirate your own saliva. You can have a hypoxic brain injury from not breathing for a period of time. So these are all issues that need to be addressed by a medical provider, whether that's a physician, PA, nurse practitioner. So this is not a wonder drug that you can just give and allow everyone that's using opiates to walk away and go on their own way. The last thing I want to mention is, you know, there's all kinds of analogies that we can use Narcan for, you know, similar to fire extinguishers. But the one I like the best is seatbelts. You know, hopefully we all put our seatbelt on to drive here today. And by putting your seatbelt on, most people don't feel enabled to drive aggressively, recklessly. You know, it's a safety device that you wear every time to protect yourself in case of a bad outcome. And I feel that Narcan is similar in the sense that it's not enabling, it's not a pleasant experience that people think of as I can do whatever I want because Narcan's handy and someone might use it on me. It's simply a harm reduction. If something terrible happens, you can buy someone 45 to 90 minutes to seek medical care, to get the help they need for all the other potential issues with an opiate overdose. And I'll turn it over to Sarah.
Great. Hi, everyone. Really grateful that you have taken interest in this topic. Narcan, as you have just heard, is a life-saving drug. My name is Sarah Money, and I am the Health Hub Program Manager at a nonprofit called Southern Colorado Health Network, also known as Access Point Pueblo. That is our harm reduction program. And so what I'm here to really discuss is just to build off of what has already been said and discuss kind of Narcan in use, as well as some local data specific to Pueblo County, as well as Colorado. So first, I'm not going to spend a lot of time talking about this for a few different reasons, but Colorado has some very progressive legislation that protects the prescribing, the dispensing, the carrying, and the use of naloxone. So naloxone, as you've heard, is a generic term. Narcan is the name brand for the overdose reversal medication. And so, you know, like I said, these legislative measures have in place that pharmacies are able to prescribe and dispense naloxone to anyone who comes in, no questions asked. Harm reduction programs are able to dispense it. Schools even recently are carrying naloxone and Narcan, both high schools, middle schools, and even colleges. There are protections in place for people that administer Narcan in good faith, believing a person is experiencing an overdose, which another thing to note there, if a person is not experiencing an overdose, Narcan won't do anything because like you saw earlier, it only acts on the opioid receptors. So it is completely safe to administer to someone who is not undergoing an opioid overdose, but is critical to give to someone who is. And so there are protections in place that will allow people to administer naloxone in good faith without criminal prosecution. So the two reasons I don't want to spend a lot of time on this is A, I'm not a legal expert, I'm a nonprofit worker, and B, there are some interesting things in place that will change some of this legislation. And that's, okay, I'm going to skip ahead one slide just to show you that as of, I believe it was last week, 2 weeks ago, Narcan is now over-the-counter approved by the Federal Drug Administration, meaning that at some point soon, it will be able to be sold right off the shelf next to Advil, next to ibuprofen, next to whatever else you're able to pick up at the pharmacy. So I bring that up because it will change the legislation, and it also indicates that naloxone is a safe drug to use to reverse an overdose. It's relatively simple to use as well. As you can see on this slide, there are 3 very basic instructions. As was mentioned, calling 911 is an obvious suggestion that we tell people, but we also realize not everybody is going to call 911. And that is why it is so important to be distributing naloxone and Narcan outside of an emergency setting. So I'll go back really quickly. We have a couple props here with us, but just want to describe the types of naloxone or Narcan products that, what's up? Oh, yeah. There you go. So what you probably are most familiar with is the nasal administration of naloxone. So that comes first in the name brand Narcan product, as well as a newer product called Kloxxado. Kloxxado was developed recognizing that it often does take more than one dose to reverse an overdose, particularly when there is fentanyl involved. So at the harm reduction programs locally here in Pueblo, these are the 4 types of naloxone products that are distributed. And I want to note that all of these products are funded outside of our office. So it is not grants. It is not, any money that we have asked for previously. It is through a bulk fund that is operated through the state. And so we are able to access these products for free and distribute them on site as well as off site at outreach events. We don't just distribute naloxone to people who are using substances. There are quite a few concerned family members that come around wanting to pick up this product. And anecdotally, we were set up at the state fair last year and were able to provide a lot of naloxone, both Narcan and Kloxxado. Most of the time it was individuals who had been prescribed it previously alongside one of their opioid prescriptions, but it had expired and they didn't have the funds to be able to go back and pay for it at the pharmacy. And so we were able to connect them as well and provide naloxone for them because naloxone as an opioid antagonist works against oxycodone, hydrocodone, as well as fentanyl and heroin. So it's not simply just for illicit substances, it's also for prescribed substances. So like I said, FDA has very recently just approved it. So we look forward to see what that will actually look like in implementation, but are hoping to see a lot more Narcan available. Now, I want to go over Pueblo specific data as well. And I do have the final numbers here if anybody is interested. But since 2018, when we started passing out naloxone and Narcan, there have been over 1,100 overdoses reversed simply from what people have reported back to our site. These data are publicly available on the SURE data dashboard, which I know you all have heard quite a bit about. But this graphic shows how many overdose reversals were performed every month. And so we have this data going all the way back to 2018, but of particular note, January 2022, there were 106 overdose reversals reported by program participants to our program. So that doesn't include everyone. We know that 106 is an underestimation and that there were more people that experienced an overdose that month. We also know that these data are not comprehensive. They do not include.
Excuse me, Miss Money. Sorry. Hey, everybody in the audience, can you please be respectful to our presenters tonight and keep it down? Thank you. Go ahead, Sarah. Thank you.
You know, the numbers I have reflected above also do not include prescription rates. So people that are prescribed opioids are also at high risk of overdosing. That I think gets lost oftentimes when we're talking about Narcan and naloxone. But, you know, here in the state of Colorado, it is required that pharmacists are supposed to counsel individuals that are picking up a new opioid prescription on Narcan and or naloxone, depending on what product they have available. So I bring this up really to indicate that there are a lot of overdoses happening, and they're not always going to be recorded through emergency services. They're not always going to be recorded at the hospital systems. For example, some of the numbers that I ran preparing for this presentation today, less than 20% of overdose reversals that have been reported to our program this year so far involved a 911 call. And so that would be 60 overdoses where 911 was not called and that person may not have lived because of that. You know, thankfully we are able to provide these products and they do work effectively. What we always will advise is calling 911 and seeking medical services, but we also recognize that isn't always going to be the reality for folks. Last year, overall, out of those 492 overdose reversals that actually, no, yeah, we'll go back 2022 out of the 515 overdose reversals up there, 22% involved a 911 call. So about 400 overdoses wouldn't be accounted for by emergency services. And, you know, we are very, very lucky here in Pueblo to be able to track these kind of data. Most communities don't have the ability to do this. Yeah, and then as you can see above, this is a slide from the SURE data dashboard specifically about emergency services. And so it's a nice juxtaposition between what we just showed. One thing of note on this, where you see on the bottom right side, outcome after patients receive one or more doses of naloxone, we see the patient is stable 53% of the time, which is a huge success. However, that is also very dependent on the individual, the substances that they have consumed, whether knowingly or not. What we are seeing with more and more fentanyl in the supply, it does take more doses than just one. Again, this year so far in 2023, the average number of doses reported for each reversal is 3.1. Last year, the average was, let's see, just over almost 3. So it was 2.4 number of doses on average that it took to reverse an overdose. And like I said, these are all products that we are able to hand out and give to individuals to reduce some of the burden on our emergency services, as well as just keep people alive. Now, I added this graphic really as a conversation starter because this is interesting. So the state keeps track of overdose counts and rates by each county in the state of Colorado. So on the left, you can see 2020, and on the right, you can see 2021. Now, there is a lag in their data, so we don't have access to 2022 yet. But what I want to note, you can see that certain counties are very, very blue. Certain counties are very light blue. The dark blue has the highest rates of overdose fatalities. So what you can actually see in this graphic is that between 2020 and 2021, overdose fatalities went down in Pueblo County and yet went up across the state of Colorado. As you can see, Los Animas County really needs support. And I bring that up in particular because we're the closest option that Los Animas County has for naloxone, for treatment, for any kind of services. You know, it is our goal eventually to be able to provide these across the entire region. But as of right now, you know, the Southeast rural regions, really, we're their only option for a lot of the supports that go alongside substance use. You know, I'm proud of this number to see that the rates did decrease in Pueblo. This is multifactorial. So this is not simply from passing out Narcan, but that is a critical piece of why we saw the overdose rate drop here in Pueblo County. And I think it's something that we as a community should be proud of and should be maybe not celebrating, but patting ourselves on the back that, you know, our community has all of these resources and supports that are slowly working away at what we're seeing. You know, it is slow going and we'll get there eventually. But I think that we can look at this and say, you know, we're on the right track. Things are happening in Pueblo that are helping keep people alive, that are also helping them achieve recovery. Now we have this slide with a bunch of links, a bunch of different things that you can read about and learn about. We have links to the substance use response ecosystem dashboard up there, as well as to that opioid overdose dashboard that I just showed you the graphics from. We also have a lot more information about naloxone and Narcan, where it can be accessed, some different, I guess OPI Rescue is a good example where it's an app that will actually walk someone through response steps. So if you download the app OPI Rescue and you believe you are coming across someone who's experiencing an overdose, you can open the app, select the medication that you have available, and it will talk you through the steps of what to do for that individual and help bring them out of that overdose. Lots of different stuff up there. We could talk forever about naloxone and Narcan and the importance, but hopefully today was able to provide a good overview. We are here for any questions, and yeah.
Thank you for the presentation. Is there any questions? Counselor Flores?
I'm I'm looking at the graph dealing with received by age and shocked that the majority of the people are older people that are receiving this, especially in the 60 to 69, 70 years. Is this a group of people that are taking prescribed opioids and needing Narcan to help them out, I guess?
So, I mean, I can kind of conjecture on this, but from what I've seen, yes, as people age, they tend to be more sensitive to an opiate overdose. And, a lot of these people are kind of hitting that age where they're getting hips done, knees done, very painful procedures that physicians are trying to treat the pain from the procedure. And sometimes, people have different thresholds, and sometimes we can see an overdose. We also see it frequently with people mistaking, they're in pain and they're using the medications maybe overly, and can accidentally induce an overdose in that manner with a prescribed opiate.
This may be a weird question, but someone that knows they're addicted to opioids, for them to get that medication and then find themselves in that situation, I'm assuming that they're not able to self-administer Narcan, because at that point it might be too late. They may not even be conscious, but you really want to have that available, I guess, for a second or third party to be able to help. That's really how it's effective.
A few things to note to that. You are absolutely correct. It is very rare for someone to be able to recognize that they are going into an overdose and self-administer. We have heard stories anecdotally, but it is very rare. Really, naloxone and Narcan, the importance of carrying it is on the bystander. It's on the family and loved ones. It's on the friends. Honestly, I carry it everywhere. I carry it on airplanes because there have been overdoses on airplanes. But if the person who is taking opioids is the only person carrying it, it's probably not going to help. And so really the key thing when we're training people on how to use Narcan and naloxone, put it in your house and make sure everyone in the house knows exactly where it is. Because if they don't, that's minutes and that's a life that's at risk. So very rarely is someone able to self-administer.
Thank you. Very valuable information. Thank you very much.
Counselor Martinez Ortega?
Thank you, Madam President. Thank you both for, all three of you, for coming to give us this naloxone info. I guess just to your point of everybody should carry it. Every time that I visit a harm reduction site, I always get 2 boxes of naloxone and I'll just give it to whomever, and it's just good to have in your car. I know you're not supposed to keep it in your car. But I encourage anybody who's visiting a harm reduction site to just have some and then just give it away. Just give it away to folks that you just kind of run into on the street, whether you're giving them some food or whatever. Just offer it up, and usually folks will take it because they know the dangers.
Counselor Maestri?
Dr. Mandrell, is there a point during the overdose stage that the Narcan can't bring the, I don't want to say patient, victim back to, is there a point of no return?
Yes, so there is basically once your heart will stop eventually from lack of oxygen. And once you've hit that point, Narcan is not likely going to reverse, you're not going to see that complete turnaround in 2 to 3 minutes. At that point, the patient's in cardiac arrest, needs CPR and kind of those emergency medical services. Yeah.
I've attended a few meetings about fentanyl locally. Do you recommend that children or adolescents administer Narcan? Is that a recommendation from, as a doctor, do you recommend that children be allowed to administer or?
I think it's very simple to use.
Mhm,
The risk of misusing it is extremely low.
mhm.
If an overdose is misidentified, it causes no harm at all. So I don't necessarily have a particular recommendation on it.
Do you
But I
think
don't,
psychologically it's beneficial for any child to participate in such an act? Do you think because say they're past the point of no return and they're, told that this is the life-saving drug that a parent needs or their loved one needs, do you think that there's psychological risks involved?
I think the situation is fraught with psychological problems. I think administering Narcan and bringing a parent back to life is probably much less psychologically damaging than living life without a parent.
Mhm. But what if they've passed that point of no return?
I- I would be personally.
What's really saddens me that we have come to be in a world or even a country that instead of, policing the border from fentanyl coming over, we've reduced all laws when it comes to drug abuse and drug use, charges, and sentencing and so forth. And now we are in a society where it's put amongst the citizens of the United States to carry Narcan in their purse or in their car or kids in their backpack to take care of this crisis. And I just would wish that we weren't so dependent on keeping people alive from drugs by having the ones to administer. And it keeps us from out of our daily life of trying to normalize us as a society in every aspect. So I just don't believe in children being involved in these types of situations. They have enough on their plate. Thank you.
Ms. Money, do you guys track the repeat overdoses?
We do not. We keep track of the individuals who are administering the naloxone, but not the individuals who are experiencing the overdose. But what I do know from individuals that are administering, people administer more than once. So like they are responding to multiple overdoses of their friends throughout a certain period of time. I'm not saying that's the same person, but people are able to respond to different people that are unfortunately experiencing an overdose.
Counselor Tensia?
Yeah, I was with a community group a couple of weeks ago, and their response to this was, we shouldn't have needle exchanges. We shouldn't have this type of naloxone. We shouldn't have all this stuff. What do you say to these people when they say that let them die? Who cares?
So first of all, like for the sake of this presentation, really, we want to stick to just Narcan and naloxone. Syringe access is a different topic. Naloxone availability has been around. The legislation that you saw above was enacted before syringe access programs, and naloxone it was FDA approved in the 70s. So this is not a new drug. What I would say is that every life has value, and people who are experiencing an overdose are victims, and their lives matter just as much as everyone else. And if we can't give them the opportunity to have the life that is going to be better for them. We can't give them that opportunity. What are we doing? And so, also, I think something that I want to note, I don't think we are not here to beg all of you to carry Narcan, although I do have 11 more boxes just like that in case anybody does want some today. But there are many people that carry it out of goodwill because we don't want to watch our community members die.
Thank you.
Any other questions? Okay, thank you, Ms. Money and Mr. Mandrell for your presentation, and Chief Huber.
Thank you.
Thank you.
I also just wanted to say the health department provided a lot of that data. They do a great job at tracking this, so thank you.
Thank you. Next up, we have the municipal code amendment. Judge Sykes, I see, is on Zoom, and we have Chief Miller here, so he'll start us off with the presentation.
I believe Judge Sykes had to step away to read a verdict, so she'll be joining us here briefly.
I'm still here. So I just wanted to let you know, I'm still here. We'll see what we can do.
Okay. I don't have a PowerPoint. Really what I've got is some data that talks about our theft from merchant issue. How many citations we have written in kind of that thing, going from that standpoint. In 2020, we wrote 336 citations for theft from merchant. Now, I don't have the ability without in-depth data analysis and an intense amount of manpower to differentiate between the over 300 and less than 300. In 2021, we wrote 283 citations. 2022, we wrote 460 citations. So far this year, we've written 205, which is about a little less than half of what we wrote in all of 2022. This same point in time last year, we had written 154 citations. So it's about a 33% increase in theft from merchant citations. I think primarily from my standpoint, I think this bill has some value. I think consequences when you break the law are important. And I think, a mandatory jail sentence would be a good thing. I know that that may not be the consensus thought process, but I think that we've gotten to a point where we've got to institute consequences back into the criminal justice system in order to combat some of the crime that we have in our community. What I will say is last week what is today, Monday? Last week, the mayor reached out to Sheriff Lucero and was able to negotiate the ability for us to take theft from merchant offenders into custody and take them to Pueblo County Jail on the third offense and book them the day that we contact them. In speaking with the sheriff a little bit further late last week, we're going to be able to institute that starting May 1st. So I think that that'll be another added benefit of instituting consequences for those who come to Pueblo or are in Pueblo and violating municipal ordinances. So I'd be happy to answer any questions. That's the extent really of my testimony, but I'd be happy to answer any questions related to the issue and defer to Judge Sykes.
Hello, members of council. I appreciate you allowing me to appear by Zoom. My statistics that I have for municipal court track pretty consistently with the chiefs. I did have my clerks pull how many charges for theft from merchant we'd had filed in municipal court for 2021. We had 322. In 2022, we had 534 charges that were filed. I also had my clerks pull a report to try and determine how many habitual offenders we had that were appearing in court. As you recall, we have a habitual offender ordinance. So if you are convicted 2 or more times within a 5-year period of theft from merchant, then you can be sentenced to jail at that point. And so I had my clerk pull cases from March of 2018 through March of 2023. So for the last 5 years. And there are a significant number of people over that period of time that had 2 or more violations. There were 256 cases that involved habitual offenders. Now, I can't tell you for sure whether or not those were the same violator or if that was different ones, but I can tell you that at least on 256 cases, they involved habitual offenders over that period of time. So right now we do impose jail for theft from merchant. My perspective on this this ordinance is that I think it's a useful tool. I prefer to have discretion as far as sentencing. I do believe that there are cases where it may warrant that jail time not be imposed, particularly on someone that has a first offense. And so if council wants to do this and would like to do it, I think it is good to have it as a class 1 municipal offense for anybody who commits theft from merchant where the value is over $300. But the jail time in those cases, I believe the sentencing should be reserved for the discretion of the court. Because we have other alternative programs available. Now, with that said, I don't think there's going to be a large number of people that fall within that category that are first-time offenders and are committing theft from merchant where the value of the merchandise is over $300. I think the majority of the people that commit these types of thefts are our habitual offenders, and they are going to be looking at jail time regardless. So that's sort of my stance on it. And I have no hesitation with imposing jail time in those circumstances where it's warranted. So I'm open to questions if anybody has any.
Thank you, Judge Sykes. Is there any questions for Chief Miller, Judge Sykes? Counselor Martinez Ortega?
Thank you, Madam President. Judge Sykes, in the ordinance, it says if there's not municipal beds available or room in the Pueblo County Jail, that those folks are going to be transferred to Las Animas, where it's not only more expensive, but further away from Pueblo. When those folks get out of jail over there, whether it's at the discretion of the court, whether it's a longer than 3 days, because this could be up to 365 days, correct? Is that what it says in the ordinance?
Anytime the ordinances allow for a jail sentence up to 364 days per charge.
Okay, and so if somebody is over there for 3 months, what is your plan on getting these folks back to Pueblo? Or are we just allowing these folks to just be dumped in the Las Animas County without a plan to get these folks back or to provide them services over there?
So we always transport everyone back to Pueblo. So whenever they are released from Las Animas, my marshal goes down and picks them up and brings them back up to Pueblo. So they are released in Pueblo. They are not released in Las Animas. The people that are going to be doing, for instance, the 3 days jail would not be sent to Las Animas. Those would be people that would stay here. The only ones that get sent to Las Animas are people that have a significant jail sentence.
Okay, thank you. And so this is a question to either of you or anyone who worked on this ordinance. The financial implication is unknown. And from 3 days to 354 days, what is the projected number? Because if we're looking at 600 offenses by the chief's 460 number plus the 33% or 30% increase, we're looking at $81,000 at a minimum for those 600 offenses at three days of jail apiece, $45 per day. What kind of projections are we looking at here?
So what I can tell you is that currently we do not have a way to track the value of the items stolen without going into each specific case and looking it up in the notes or by citation or the officer's narrative. So you have to understand that these charges that we're talking about that have been filed over the last couple of years, not all of these are over $300 in value. In fact, I would say that very few of these comparatively are going to be over $300. I think some of the numbers are increasing, so I don't know if it's just because I've been paying more attention to it lately or it's been happening more often. I have seen more thefts for over $300 over the last few months. But even when I say that, I'm talking, maybe a dozen. And
So a dozen out of 460, or let's even say generously, 50 of those don't apply. Do you really think that this is going to be a deterrent? Or do you think this will continue to fill up the jail? And how much does it cost? I'm just trying to think of the financial implications that this has on the city. Because how much is it to transport all these folks back from Las Animas? And how much is, I'm just trying to think of some numbers here or figure out some numbers, because this has huge ramifications on the city if we don't do this right.
So I can tell you that fiscally, as I said, I believe that the majority of the people that are going to be affected by this ordinance are those habitual offenders who are typically already going to receive jail time anyway. And so that would be something that would already be included in the budget. And we, transportation costs for our marshal and the cost of our marshal are already included in our budget. I don't know that this would significantly increase that need. Now, with that said, again, we haven't tracked those violations for over $300 specifically. So I don't know how many of those, how many of that would be affected by this ordinance. The 3 days jail, you have to understand too, that whenever they go to jail, they're entitled to good time, which is typically about 50% of whatever they're sentenced to. So if you sentence them to 3 days, for instance, whatever that ordinance says, 3 days jail, they're going to be serving about a day and a half or a day. And so factor that into the cost as well. But I understand your point. Your point is well taken. But for me, it's too early to tell fiscally what this is going to do, because we just don't track that by the value. And I don't know if the chief has something to add to that.
I don't really have anything to add on the fiscal note, but what I will say is, there's a lot of variety of ways to look at the implications of this ordinance, and the fiscal impact on the city could be felt through a variety of ways. One thing I'll say is one of the issues that we get a lot of pushback from is our inability to have people taken to jail on different offenses. Now, this is on the sentencing side of things, but I think there's some utility in having an ordinance that has some ramifications when we're having the kind of theft problems that we're having. And I don't know how those compare to other communities, but a 30% increase is pretty significant year over year. So I that's why I would be in favor of it. I think it could potentially help. And if what the judge is saying is true, it's not going to be much different than what she's doing already. It would just be codified that this would be what we would do.
It would give her the ability to administer more jail. And don't you think by cutting that $81,000 in half, we would be able to make the businesses whole again better than any kind of punitive justice would ever be able to do? I'm encouraging restorative justice as opposed to this punitive.
Mayor.
Judge
So
Sykes, we're required
can-
to, Judge, let me just interject one
Sorry.
point here. We're required to appoint an attorney for everybody who's facing jail. Is that correct? And we appoint them and we pay for that attorney if they're unable to pay for it themselves, correct?
That is true. But again, the fiscal note, it's hard to determine because I believe that for the vast majority of these people are already facing jail time, so I would already be appointing counsel. But for those people that would not be facing jail time, so it's their first or second offense and it's over $300, I would have to appoint counsel to represent them in the case because they would be facing jail time.
Are you able to estimate, Judge, how long it from the time somebody gets a ticket or is initially arrested until a final disposition of their case when they might be going to jail?
So if, from the time of arrest, if they're allowed to arrest initially, like the jail has said they will take theft from merchant defendants at this time, we have to arraign them within 48 hours of notice from the jail that the jail is holding this person on a municipal only charge. So that would be the initial 48 hours. During that time, they're appointed an attorney and then they come before the court on a video arraignment. If they entered a plea, they can enter a plea at the time of the arraignment. If they did, then presumably they would serve that 3 days and may get credit for time served back to the date of arrest, depending on the circumstances. If that it's set over for a pretrial or a trial, the pretrial usually takes place. Our goal is to get anybody in custody to pretrial within 7 days. Now, depending on our ability to transport inmates and defense counsel and things like that, that may get pushed out. But that's the standard that we try to keep, is that we get in custody on municipal only defendants to pretrial within 7 days. If they do end up going to trial, and they're going to continue to be held, they would have a bond set at this point. But then the trial is typically within 30 days after that.
All right. Well, and as the chief indicated, we've reached out. I think what's important is that they spend some time in jail as soon as they're caught in the act, that arrest, that's spend a day or two in jail right then. That makes a much bigger difference than sentencing them to jail 3 or 4 months down the road. And it makes a difference on their friends, I think, who might be with them at the time they commit this offense. If their friend knows he went to jail right away, rather than, 30 days from now, he got sentenced to jail, who cares? That's just part of the deal. So I think that's important that the sheriff has said on some of these cases, we're able to put them in jail if we catch them.
If I could chime in too, just to comment on one of the statements made. We do have a restorative justice program here at Municipal Court. We are looking to expand it to adults. There may be opportunity to do that for theft from merchant. In fact, that's one of the areas that we're focusing on. But it would have to be for an appropriate case. So that would be for a first offense, someone who had not gone through the restorative justice program before. But the other thing you need to consider with the jail, especially here with Pueblo, they do have a substance abuse treatment program. They have to be in custody for a certain period of time before they get to take advantage of that program. So that is also one thing that they can take advantage of while they're in custody that can deal with the underlying issue. The defense attorneys that work in municipal court are really good at trying to find alternatives, trying to find these people resources to deal with the underlying problem that is causing the theft. So I routinely release people to do inpatient drug and alcohol treatment in lieu of jail. And so, but sometimes it takes a while to get those processes in place because we don't have the availability of beds in Pueblo that they may have in other cities. And so sometimes we're waiting. I have sentenced someone to jail and it may be a month before they receive a bed. When they do receive a bed, defense counsel will petition the court to release them on the condition that they participate in this inpatient treatment. And then their sentence is suspended based upon successful completion. So there is the goal is to get them resources to deal with the underlying issue. But I do agree with the mayor and with council, other members of council, and with the chief of police that there is some deterrent effect to people if they know that they're going to be arrested initially at the time of theft. And I think that's important from what I've heard from loss prevention officers through our restorative justice program, and also from some of the defendants. So for what it's worth, I just wanted everybody to know that.
I heard loud and clear that you support this ordinance. The question is whether you feel the judge should be allowed through an amendment to this ordinance to have the final discretion given a set of circumstances that might warrant her to go a different direction.
I think I think the only thing that I would say to that is if that was what the council decided to do, I'm not sure it would be then a mandatory 3-day jail sentence. And I don't know if it would have the same impact necessarily on those that hear about or understand that this is be the process. I want to be clear. I don't advocate for ordinances really. I think what's important for me to try to get across is the implications, I think, of an ordinance. And I think that if people in our community understand that if you come down to Pueblo and you steal, you're going to face a mandatory jail sentence, that would have a deterrent effect. That's what I would say.
I guess, Judge Sykes, clarify the initial 1, 2, or 3 days in jail at the very beginning, and then the ultimate sentencing later. Could you spell out and differentiate between those two?
Sure. So if they are arrested immediately upon the offense, the initial day or two in jail is until a bond hearing. So we have to have a bond hearing within 48 hours. So they could spend up to 48 hours in jail before I set bond. And so that's when they come before me. I advise them of the charge. And then I determine whether I'm going to release them on a personal recognizance bond on the condition that they're going to return to court, or I'm going to hold them on a cash or surety bond. So that's the initial up to 48 hours. And it's up to 48 hours from the time the jail notifies me that they're there on a municipal only offense. So if they're arrested on a municipal offense, but they also have a county or district court warrant, they could spend more time in jail from the date of the original arrest until they are ultimately released. But let's say they're arrested only on a municipal only charge, then they would be arraigned within that 48 hours. So that would be the initial up to 2 days spent in jail. And then if they are not released on a personal recognizance bond, or if they're unable to post a cash or surety bond, then they would be held until their next court date.
Thanks for the clarification. Thank you.
Counselor Tencio.
I like the idea of Judge Sykes having the discretion to impose the penalty that's necessary. If a person is taken directly to jail when they're caught, they take 48 hours to get arraigned anyway. So if they were imposed 3 days jail time, they would have already served it.
Or close to it.
Or
Yes.
close to it. For those, Judge Sykes, for those people who steal over $300, I would imagine that the penalty would be jail time in most circumstances anyway.
Not
I would hope
currently.
so anyway.
Currently, the only way that they're facing jail time is they're a habitual offender, because theft from merchant and theft in general is a class 2 municipal offense, which carries with it only a maximum $1,000 fine. So if it's their first or second offense, they would not be facing any jail time. So that's where this ordinance for thefts over $300 would change the character of that. So on their first or second offense, if it's over $300, then I could impose jail time. And if this passes, then it would be a mandatory jail sentence of 3 days. And so, you know, in conjunction with everything, I think it's important, you know, if the police department is going to be able to arrest everybody on a direct arrest from theft from merchant, I think that's important. They're going to spend up to 2 days in jail before I see them, maybe sooner, maybe not, depending on the day of the arrest. And so the 3 days jail could be in addition to that time, or it may be just, you know, credit for time served. But I do think it's important, if this is the direction that the council is going, to make it a municipal one offense, a municipal class 1 offense, so that jail time could be imposed in those circumstances. Because we do have jurisdiction of theft up to $2,500. So I haven't seen a case where it's that high, but there could be the case on a first offense if someone is stealing over $2,000 that would definitely warrant potential jail time, depending on the circumstances of the case. And know too that I don't really have any position on the ordinance, other than, and my position is you guys make the law, and I impose it based upon the ordinances and the facts of the case. So it's up to you guys. I'm just trying to give you an idea of what is going to happen, or what is currently happening in municipal court.
Do you have any idea how many of these cases are first-time juvenile offenders?
I can tell you that we have a large number of theft from merchants for juveniles. I cannot recall, but maybe 1 or 2 juvenile thefts that have been over $300. Most of my juvenile offenses occur at Walmart or Spencer's. Is a huge.
What do we do with those? Do we put them in jail right away too?
No, this would not apply to juveniles. Juveniles should be excluded from this because juveniles don't go to jail.
Yeah, we
Not
could.
from municipal court
Is there any way
anyway.
that would there be any way that an offender be taken to the judge first and have some kind of disposition there before going to jail?
It is possible to do that. One of the problems that we run into is that anytime a defendant is brought before the judge in custody, then we have to have defense counsel. So if I'm available, I'm happy to see the defendant in front of me. And if it's a class 1 or class 2 municipal offense, it's they're not facing any jail time, so they could potentially be arraigned. But if they are facing jail time and they are brought in and in custody, I have to appoint defense counsel, and we don't have defense counsel readily available to come over and represent them. Now, I am willing to work with the police department if we set up a particular date and time where they want to do some heightened enforcement. Then I can try and get all of those players together so that they are available if anybody were brought in. But just on a daily basis, it would be really hard to make that happen because we don't have defense counsel. So what they would have to do is take them to jail, and then we would put them on the very next jail docket available.
I understand the reasoning for this, mostly political, but I would rather put the discretion in the hands of a judge, Judge Sykes in particular.
If I could just clarify real quick, the opportunity to take them to jail immediately would be on the 3rd time that we dealt with that individual. It wouldn't be every offense, the first time we arrested that individual. And for just for understanding, we even consider a citation an arrest. So on the third arrest, we could do a physical arrest.
Maestri, did you have something?
Yes, Chief, I noticed that when I'm at the store and people are stealing, none of the employees or loss prevention come out and try to stop them at all. Is that because, we have that bar set at $2,000? And would I'm sorry, 2 parts to the question. Would the loss prevention officer at this point be the one stopping them and holding them until the police department, detaining them till the police department gets there?
Yes, ma'am. The first part of your question, that is store policy. That has nothing to do with any law that's been passed or any direction that we've given as a police department. Each store has their own policy on what their employees are or are not allowed to do when it comes to theft. As it comes to the other part of it, it could be an employee that stops the theft. It could be loss prevention that stops the theft. But yes, those would be generally what would happen prior to our arrival.
But you're saying that the store's policies now is they're not stopping?
Some of them, not all of them. Some stores have that policy. Some stores do not. Some stores go so far as to they won't even release video of the incident to us for charging. But those are the smaller numbers. Most stores have some sort of loss, especially the bigger stores have usually a loss prevention person that's there that would take action, or if they couldn't because they were in the middle of taking action somewhere else, would later provide us with the evidence that we needed to prosecute the case.
Okay.
Counselor Winter.
So Judge, I'm a little confused. So a class 2 misdemeanor right now in Colorado is $300 to $1,000. So you keep saying class 1. Are you dropping the offense from a class 2 to a class 1?
So under our ordinances, our offenses go, our class 2 offenses are actually lower level offenses, or they have lower penalties. So a class 2 municipal offense carries up to $1,000 fine. A class 1 municipal offense carries a higher sentence, so it carries up to $1,000 fine and 364 days in jail. That's how our ordinances are written.
Okay.
It may be a
Yeah,
little bit different.
Yeah, sorry about that. So this ordinance, like you said, they would be going to jail anyway if it was their third time.
Typically, if it's their third offense, then they would be within a 5-year period, they would be considered a habitual offender and would be looking at jail time anyway.
Okay. And 300 to 1,000 is up to 120 days in jail right now. And then
300
1,000 to 2,000 is 364 days in jail up to.
So we don't break it down by the monetary amount.
Oh, you don't. Oh, you
No.
don't. You don't go by Colorado state law.
So Colorado statutes don't apply to municipal court. The only thing we enforce in municipal court are the ordinances. So our ordinances are written the way that they are, and they don't break it down by the amount of the theft, unless of course you guys pass this, and then it would have that $300 threshold. But currently there is no division because of the amount of the theft.
Oh, I get it. Okay. And then Chief, how many direct arrests do you have?
Can you define what you mean by direct arrest?
Oh, well, the judge mentioned a direct arrest, meaning like a police officer would come and arrest them for stealing something at a store. Like
If
how
it's-
often does that happen?
Right now, if it's less than $2,000, it doesn't. Because we can't, right now, until this
Well, like
agreement.
What Regina mentioned, with unless you had total tort reform with merchants, this isn't going to work at all. I mean, how many people are caught for shoplifting?
Well, we wrote 460 citations last year, so at least 460 people were caught in Pueblo stealing.
And is the merchant detaining them?
Yes.
And you're
In
allowing the
those
merchant to
cases.
detain?
Yeah, they are allowed to. They are allowed by state law to detain somebody that commits a crime in their building.
Without due process?
Well, holding them and detaining them is not where the trial happens. It happens after we determine if there's probable cause and forward that case to the court, and then the judge will make a determination in due process whether they should be sentenced or not.
Right, that's what I was getting at. I mean, a store merchant is not.
Right, but they're not sentencing them. They're holding
Yeah, I
them
get that,
for
but
us.
what I was just making a comparison. I mean, they have no due process, and I think they'd be illegally held at that point.
No, that's
But
not
they're
true.
not.
If they have reason to believe that they've committed a crime, they have the legal authority to detain them until we get there. Now, we would listen to what the person said. We would listen to what the store said. And if we determine probable cause didn't exist for the arrest, then we would let the person go and we wouldn't cite them.
Okay, all right. So you don't look at Colorado law at all? All we have in municipal is the $2,000? Is that what you just said? $2,000?
I didn't say anything about the municipal ordinance. The breakdown is this. In Colorado law, at $2,000, it becomes a felony theft.
Right.
So in that case, we can take an individual into custody and take them to Pueblo County Jail. They will accept a felony arrest at Pueblo County Jail prior to May 1st of this year.
Okay,
Prior $1,000, then or $2,000, then we could issue a citation to that individual and let them go, because we could not take them to Pueblo County Jail for an arrest, physical arrest.
okay.
So that's where the breakdown is. It is counterproductive to do the paperwork or put the workload on the county or district courts for thefts under $2,000. When our municipal court, we get better results out of our municipal court than we would out of county court. So we don't forward those cases to county court. We forward them through the municipal court system. After May 1st, with the agreement of the sheriff, on their third time that we would have issued them a citation, we can do a physical arrest and take them to Pueblo County Jail and book them in on theft from merchant. So I hope that answers your question.
Well, I guess so. If you're not going to throw them in jail unless it's their third time anyway, I don't know. I guess I just don't understand this, the reason.
Well, that's my point. I think we should be able to throw them in jail on their first offense. I think that's what would deter our theft. But the issue we have is we don't have a municipal jail, and the county jail has a process that they want us to work through. It's better than it has been in years. The third offense would be better than it has been in years.
But do you have the jail space for that?
They say they do right now. Now that could change in the future.
Are they going to hold cells just for this?
I don't know what they're going to do on their end. What they have said to me as of Friday afternoon of last week was that come May 1st, they would allow us to bring individuals on the third offense, the third time we've charged them, to Pueblo County Jail. Now that could change in a month. It could change in 4 years. I don't know. I don't control the Pueblo County Jail. So as you know, so they would have the ability to step in at any point and change that as they did in the past. But that's where we would be at after May 1st.
All right. And Heather, would you mind telling the audience that when we're speaking, we don't need to have distractive noises as well? Please, can you do that?
As Counselor Winter states, if everybody could just please be quiet so we can hear. Anybody else?
Just one more thing I'd like to say. I realize that there's a concern in the cost involved, but we've already lost Bed Bath & Beyond, Saturday Morning Store. A lot of our constituents call us from the business community threatening to pull out. I mean, we have to take some measures to try to do something. And if this is going to be a deterrent, I would just hope that, we get the support from the administration who really execute this ordinance so that we could try to make a difference for our business community, because we're a little bit behind the times. And I know you read beyond, you look at the cities and municipalities beyond Pueblo, and even big box stores are pulling out of major cities now because they're tired of the theft. They can't afford to be there. Portland is losing a lot of retail businesses because of the theft, and nobody's doing anything about it. So it's time that we start to try to do what we can in our community to prevent this from happening. So I'm glad that everybody's talking here is on the same page.
Counselor Flores.
I wanted to say, there's probably a lot more shoplifting that's going on. And this is the reason why. If you run a large retail store or even smaller stores that might have a risk manager, they do not want intervention by their employees. In fact, many companies will probably let an employee go if he goes and tackles someone. And because of the legal liability that's presented, either hurting an innocent bystander, they do not allow their people to go out after. The other thing is that if an employee gets injured, the cost to a retail store could be a lot more if that person injures themselves. So they don't want a workers' comp claim in the middle of all of this. It's a very complicated issue, but at the end of the day, there are a lot of retail stores that are going under because they're being out competed, because we all know that the consumer ultimately pays for the shoplifting. So the stores are just adding that to the cost of their product. And that's why we need to get a handle on it. But anyway, that's the reason why you have a lot of stores that will just watch them, just watch them walk out with the product because they don't want their employees getting injured or a bystander getting injured. Thank you.
Counselor Atencio and then Counselor Winter.
Yeah, just a thought. I know we want to deal with those people. We want to do away with a lot of the shoplifting, raise the minimum wage to a living wage, and that'll do a lot to help out.
Counselor Winter.
Yeah, Dennis, that's what I was talking about with tort reform. I mean, unless you have that, you're not going to be really catching a lot of the shoplifters. Also, many of these stores are closing because of Amazon and home delivery. I mean, that is what's taking over. I mean, I don't know anyone that even practically they have Whole Foods delivered to their doors. So that's the main problem for sure.
Okay, thank you, Chief, and thank you, Judge Sykes, for the report. Next, we have Crime Stoppers Lights for Safety, Chief of Staff Solano, Julie Rodriguez from Black Hills, and Crystal Estrada.
Good evening, Council. Thank you for having us. We are here to talk a little bit more about the Lights On for Safety project. Tonight we have myself, Crystal Estrada, we have Patty Olnick and Julie Rodriguez, and of course, Ms. Solano is going to chime in on what we have going on this exciting project. So what is Lights On for Safety? It's a public-private program designed to increase safety for our local small businesses while providing energy management and education. And in this project, there are several partners who are helping make this go forward. And one of the main partners, the one who had this idea was Black Hills Energy, and we thank them very much for bringing this to Crime Stoppers, along with the City of Pueblo, Mayor Gradishar, and the Pueblo Police Department have all been great partners in piecing together this project that Crime Stoppers will be carrying on for our community. Patty?
So how does Lights On for Safety work? This is where small businesses can apply for assistance beginning a week following the press conference, which we are still waiting to schedule that. And the process begins with a free initial energy audit from Black Hills. And this is performed by a trained energy assessment auditor. And they are from Franklin Energy, and they are a contractor with Black Hills. They do our small business direct install program and have been responsible for hundreds of energy audits throughout our service territory. And then the Pueblo Police Department will conduct a free crime prevention through environmental design assessment. This is also to help advise the small business on changes and updates that they can use to defer crime on their property. And these audits will provide solutions that increase customer safety and help save energy by providing interior and exterior lighting and cameras.
Okay, there you go. Thank you, Council, for having us back. The budget for Lights On for Safety is $400,000 at this point. That's $200,000 from Black Hills Energy, and then an additional $200,000 we're hoping that you'll approve from the City of Pueblo ARPA dollars. The money will be for equipment and installation. At this point, when we came to you about a month ago, we talked about 40 businesses, approximately 40 businesses that we would assist. We've had a few lessons learned since then. In talking to the City of Aurora, they had a similar program. And what we've found is they had to cap the amount at $15,000. Initially, when we talked to you, we said $10,000. And what we have found is we don't want to leave the businesses to have to incur any sort of cost when we go to them and we do this assessment and we find out what their needs are related to better lighting or enhanced lighting for their businesses in addition to the cameras. We don't want to leave them in a place where they're having to figure out how to raise the remaining amount of money. So as I said, lessons learned. Aurora's, and granted, they had millions of dollars to work with, but we did find in talking to them that we needed to cap that at a higher amount. And each business, they may not hit that $15,000 mark. It may be lower. So I think it'll kind of wash out, I guess, is what I'm trying to get to. And then one other thing that was asked of us at the last meeting here is to ensure that we were looking at small businesses in the census tract. And so obviously they will have priority as we start this process. Since Crime Stoppers is an all volunteer organization, we as Black Hills decided that we should pay them a fee for the time that it's going to take them to process the applications, cut the checks, and really gather the data. So that's where that $10,000 is coming from. Timeline, obviously we're here today at your work session. We want to move forward a first reading on April 24th, second final reading on May 8th, and then a press conference to announce the program the week of May 22nd. And then following that, the application process will open. And the plan is to give us a week to do a little more marketing after the press conference. Press conference would include the mayor, the chief of police, Crime Stoppers, Black Hills. When we last came to this meeting, one of the asks from Councilor Martinez Ortega was some sort of flyer or something that could be passed out. And we have a draft that, and I think Laura gave that to you. So an initial draft that we're working off of, and this is something that we can distribute through the Pueblo Greater Chamber, Latino Chamber, Pueblo West Chamber, the Downtown Association, neighborhood groups, local businesses, and then obviously you can push this out to your constituents as well. And this will be in various forms. When I say the chambers, we'll have this available in a version that they can add into their newsletters. We'll have a version if you would like this. I can do it smaller, bigger, whatever you think, poster size. However, we can get the word out in each of your respective areas. Do you have any questions for us?
Questions? No? I think it looks good. Thanks for getting everything tightened up and
Thank you very much.
Thank you.
Counselor Maestri, actually.
Weren't we talking about how this money was going to be spent? Like half of it was going to be spent on businesses in the census tract area. The other half was going to be open to just businesses. Didn't matter what the criteria was, they could apply.
That is correct.
And has that been?
And that is still the plan.
Okay. And so I guess, I know that there's a lot of people in this community upset with their Black Hills energy bills because they're so high. And yet we have money coming from Black Hills Energy to donate towards this cause. And so on another note, it's not I don't know that it's a deterrent because people can steal and not be arrested.
Sure. So just to address the bill issue, we have rebate programs in Black Hills where we give back money to our residential customers, commercial customers. We have a low income program and even a program for school children. We give back about $4 million a year in those
Yeah,
programs. And so this is another extension of that.
I've seen some of my constituents rebates and they're pennies on the dollar.
Well,
So I'm just saying.
It can be, and they can be, we give tens of thousands of dollars to some of our customers too. It depends on the scope of the project. But in this case, if you get the concern that there's, my bill's going to go up because I'm funding this project, this money is earmarked for that.
Because it's funding the project. What I'm saying is it's really not a deterrent anymore because it's not stopping people. We have cameras everywhere in this town. It's not stopping people from breaking windows, destroying other people's property, stealing from people. And so
Lighting is a good deterrent though. If you feel cameras aren't, lighting is.
it used to be when they got arrested and then they would have some sort of punishment for it, but they don't do that anymore. So.
It takes a village.
Okay, if there's no other questions, thank you guys so much. And we look forward to seeing that on our agenda and look forward to the press conference coming out. Okay, and that will conclude our work session. We will start our regular session in 10 minutes.
Of course, yeah, yeah.
Of
You know, it's
course.
just not cool that.